Congress is back in session, the funding fights are about to begin, and we have some education to do. So let's jump back in with another Alliance Advocacy Update. So we previously defined what Section 330 funding is, but we can define it even a little bit better because funding for community health centers is really broken up into two buckets: discretionary funding and mandatory funding. Now, discretionary funding is funding that has to be approved annually through the congressional appropriations process. Congress has the ability to decide how much, if any, to allocate each and every year, and this comes up through the annual budget bills like what we'll see this September. Mandatory funding, on the other hand, is guaranteed by law and does not require annual approval. It is set by authorizing legislation which establishes a multi-year funding stream, and the Community Health Center Fund should establish mandatory stable funding. Now, I threw some air quotes around the word should when talking about our guaranteed funding because unfortunately for Community Health Center funding, that hasn't been the case. So what's happened? The last actual multi-year funding that the Community Health Center Fund received was allocated in fiscal year 2021 through the end of fiscal year 2023. Since then, Congress has not successfully passed a budget bill and has been passing back-to-back continuing resolutions for the past 2 years. These continuing resolutions have provided at most a year of guaranteed funding, and sometimes only up to 6 or 3 months. And the guaranteed funding that the CHC fund is supposed to receive is always set to expire at the end of these resolutions. And that next expiration date for CHC funding is September 30th. Funding for community health centers has not increased since 2023. And when you consider inflation and other recent federal changes, community health center funding is in a much worse position than it was previously. That's why we'll be encouraging you to contact your member of Congress and tell them just how important continuing to increase community health center funding is. So be on the lookout for some upcoming calls to actions coming from us. Feel free to connect with us at advocacy@aachc.org, and until next time.